Thank you very much indeed for coming to this event this morning. An event which I suppose marks the launch of something called the Success Regime. More about that in a little while. I'm Neil McKay. I've been asked to lead the Success Regime, chair the programme board, and generally get involved in the health and care system in Cumbria to see how I can help move things forward. Again, more of that in a moment or two as well. I'm told that this venue is strategically important because it's roughly equidistant between Carlisle and Whitehaven. Somebody told me that the precise equidistance is somewhere in the lake, and I think it was felt that might be a touch too far to find something suitable as a venue. But it's good to see you all here today. The other thing I need to say to you is we're filming and recording today's events. If any of you are unhappy about being filmed, and particularly if you want to make a contribution, please tell us, and the camera will avert its gaze. And I don't know what we'll do about the sound. I guess if people don't want to be recorded, can we deal with that? We will deal with that. Okay. So, as I say, this is the launch of the North Cumbria Success Regime. There are three areas identified by the Secretary of State for Health in England with particular challenges. There is Essex, there is North Devon, and there is North Cumbria. And for each of those, the Secretary of State has established something called a Success Regime. Now, I've been spending a little time in Cumbria for the last couple of weeks, and a number of things strike me already. The first is that we have in this locality some extremely dedicated people, staff who work within the NHS organisations, but also in the health and care system, who come to work every day to do their best for patients and for citizens, people who are really committed to doing a good job. I also detect organisations who are as committed. Organisations who want to make a difference, want to try and find a way of dealing with the deep-rooted challenges that exist within this part of the country. And before I say something about the challenges we face, I think it's only reasonable just to reflect on some of the good things as well. I think it's entirely reasonable to remind ourselves that about the progress that's been made over the last couple of years at least. And although the CQC, Care Quality Commission report published last week, had some criticisms, and again I'll refer to those later, there was a theme of recognition of improvement, for which people ought to be proud. Improvement, but still not enough improvement, and not at a fast enough pace. Particularly improvement in terms of a striking reduction in death rates, more hospital-based mortality rates, which is a credit to everybody. Also, a very, very high score, good in terms of care. The Care Quality Commission believes that the care that's provided within just one part of your system is good. That's fantastic. That's very, very creditable. But despite this, the health and care system in Cumbria, North Cumbria, is fragile. It's fragile. I've worked in various parts of the country over the years. I've come across fragility before, but this is as fragile, I think, as just about anywhere else I've come across. That's not to say there won't be solutions and ways of dealing with it, but I just say that for what it's worth. It sets a mark, I think, about the kind of focus we have to provide. So, in addition to fragility, what is it that makes North Cumbria one of the three most challenged systems in the country? Well, there are safety and quality concerns. I've alluded to those already. The Care Quality Commission makes that very clear in its report last week. And even though there is improvement, there's an area where the service is deemed to be inadequate. And as a result of the overall report, the acute trust is still within special measures, unfortunately. There are chronic recruitment problems. I've not come across an area latterly or in my time in the NHS over many years, I don't think, where the recruitment problems have been so severe as they are here. They are a cause for concern up and down the country, but they're more severe here than I've witnessed before. The CQC report refers to 50 consultant vacancies at the time they did their last inspection. I don't know what that is as a percentage, Anne, but that's a lot of consultant vacancies covered by locums and agency staff who do their best, but we know that it's not the same as having your own full-time people in post. There are chronic recruitment problems in primary care, general practice, not something that has been in the forefront of the reports I've read so far, but I know about that, and we need to do something about that. And there's frankly, a chronic history of not delivering key service requirements. I was looking at some data yesterday, and I'm afraid against the NHS constitution standards, waiting times, emergency care, IAPT for mental health service measure, I suppose, cancer rates, etc. A sea of reds, where unfortunately, significantly, a patch which finds it difficult to deliver those kinds of targets. And then the money. Financial deficits. I don't know what the current position is, and that's something I want to get to the bottom of as soon as I can. But in 2014, a forecast was made that there would be a deficit at the end of the 14-15 financial year of 30 million. And if nothing was done, it would rise to nearly 90 million by 2019. That's on a spend for health of 500 million. And that doesn't include the social care challenge. And because of the tight interconnectivity between health and social care, I don't think you can just look at financial pressures in the health sector without taking account of the pressures within social care as well. So there's a big financial challenge that needs to be tackled. So it seems to me, whichever way you look at it, in terms of service development, a compelling vision for the future, in terms of our ability to recruit high-quality people to come to work in Cumbria, in terms of routine delivery of targets, if you like, in terms of quality and safety, there is an absolutely overwhelming case for change in the way in which services are provided. Now, I've got the success regime 6 main priorities. I keep reminding myself that we'll have to keep them to manageable numbers. I could have many more than 6, but there are 6 that I'm really keen to push on with over the next few months or so. The first is we need to have a compelling, ambitious, exciting service strategy for health and care for the whole of Cumbria. You're pretty good at writing strategies in this patch, but they're not integrated. Some of them are fairly number-free, and what you're frankly not very good at, but you're not alone in this at all, there's a sense of not being able to find a way of implementation. So we have to change that. But the first thing is to make sure we've got a compelling vision for the future. We have to have, secondly, a short-term focus on priorities. It's unacceptable, isn't it, for the residents of North Cumbria to get poorer services in terms of just access, for example, notwithstanding all of the good things they get, than in other parts of the country. So we need a sharp, quick, rapid focus on that. The third thing is we've got to find a way of tackling the workforce issues. I'm thinking about, talking to people about organising an urgent summit and drawing in experts not just from within the patch, but nationally and, if necessary, internationally, to think about how we can do something in the short term to alleviate the workforce pressures. We can't wait for the university production line to produce more graduates in 5 or 7 years' time. We have to do something now, and it's a real problem. Other places are thinking similarly, so we better get ahead of the curve and make our impression before others. The fourth priority I have is to push on with the deliberations around what's become known as the acquisition, the fusion, if you like, between the Northumbria Foundation Trust and the North Cumbria Acute Hospitals Trust. I think it's a great idea. I'm a big admirer of the Northumbria Acute Trust. It has huge talent, skills, and I think it would bring great benefits to North Cumbria. And actually, I think North Cumbria will offer benefits for Northumbria as well. I think it's a real opportunity, and I want to see if we can find ways of moving that forward more rapidly than has happened in the recent past. My next, I think this is my fifth priority, freedoms. Freedoms. I think it's essential that the people in this room are found more opportunity for headroom. I know what it's like running a part of the health service when the chips are down, the money's running away with itself, if it is. Service delivery targets are not being delivered. You get onto a treadmill. It's the day's target, it's the day's delivery. We have to break through that and create headroom for people to be able to think strategically and about the future. So I'm interested in testing the regulators, and there are representatives of the regulators in this room today. I'm looking to my right. We want to put forward freedoms. If the vanguard movement in health can have freedoms, then why can't we? As a simple proposition. And I was really interested to read what I might call the freedoms in the Cumbria deal. I don't know, for those of you who haven't read it, the Cumbria deal is the proposition for devolved authority responsibilities to be passed to Cumbria from central government, and there's a chapter about health and care freedoms. They're brilliant. They're exactly what we have been thinking about on the health side, and we need to fuse those ideas and push on with those as urgently as we can. My sixth priority, I want today to herald the most intensive, inclusive, comprehensive clinical and public engagement programme about health and care that North Cumbria has ever seen. We must not ignore the views of citizens. We have to take account of the views of clinicians, who, more often than not, have ideas about solutions that evade people like me. So an enormous engagement programme during the course of the next while. So, as you sit and think about those things, you may think, well, I've heard all of this before, in one guise or another in the past. Who's this guy who's coming in to talk about delivering all of these things? I don't know whether you have or not, but those are heartfelt views from me about priorities which I want to push on with. So what will the success regime do that hasn't happened in the past? Well, first of all, I think my appointment and the establishment of the success regime, a small programme team led by our programme director Kirsty O'Connor and a programme board which has representatives of the agencies, health and care agencies in this room and various work streams. We will provide a bridge between the different organisations and make sure that we coordinate effort. Because frankly, that's not been a feature, as far as I can tell, although it's not absolutely absent, not been a consistent feature in Cumbria. I have to say it's not a consistent feature in other parts of the NHS and the care system. So we will provide a bridge. We will make sure there is intensive support from within our team, but we will have access. We have access to national experts. We, if need be, will have access to international experts to come into North Cumbria and help people on the ground to think about solutions. I should emphasise, and I will constantly, that the solutions that emerge have to be yours. We are not going to say to you, this is the plan, go off and implement it, because if you don't believe in it, if it's not your plan, then it won't happen. That's why I'm putting so much store in engagement. We will have the ability to support boards, the NHS boards, and if the local authority is interested in help and support, then obviously we'll be able to think about how that might be offered as well. And we'll certainly be arguing passionately to create headroom. But the thing I want to instill is a greater sense of urgency, pace, delivery. And that's not a criticism of the people in this room, it's just to add to what I know the people in this room want to be able to achieve, and I think we can help. So what will success look like? Well, the CQC report makes it clear that there are two criteria that they wish to see dealt with, delivered, and then they'll consider their position in terms of special measures for the acute trust. They want to see, and I think this is absolutely right, this long-term vision for health, and frankly, the juxtaposition with care services as well, which can demonstrate safety, high quality, and financial sustainability. That has to be the big priority. We have to push on with that, and we need to make sure we do that. The second big priority that the CQC talks about is importation of new ideas, the transfer of ideas, if you like, across the Northumberland Cumbria boundary between Northumbria FT and the Acute Trust. I think there's a mutual benefit there, and I want to see how we can push on with that. Those are the requirements of CQC. They probably would have been my priorities as well, but they're certainly the requirements of CQC, and we must respect that. But there's so much more. So in the next 3 months, if we meet together again, say, just before Christmas or in the new year, I expect to be able to report we'll have made progress in the following areas. Improved performance. Winter is nearly upon us. Felt like it when I was woken up by the rainstorm at midnight last night. Winter is nearly upon us. We have to get organised to make sure we have a safer passage through winter, and at the same time we can deliver better on some of the other access targets. And I've already had an early discussion with the leaders of the SRG, what's that called? The System Resilience Group, which has a responsibility for dealing with these things. And we'll be talking more about that at the programme board meeting this afternoon. I want us to have an emerging view of the strategy. What does it look like? What do we think we're going to be doing in terms of the future shape of services across the system of North Cumbria? It won't be agreed by then. There might be things we have to deal with more urgently than others, and we'll have to think about those very, very carefully. But I want to be able to demonstrate progress, collective progress with you about how we're going to develop our ideas there. I want to have a workforce plan, something which is truly radical. And as I stand here, I don't know what it's going to look like, but we have to find a way of breaking through the chronicity of our staffing difficulties in the patch. I want to make sure that we at least arrest the financial deficit. I don't want to see it keep building. I want to see it plateauing, and I'd far rather see it starting to drop. That's something I need to give some attention to, and we will do just that. I want to push on with the acquisition that I've alluded to earlier, and I want to make sure, I'd like our regulators to bestow some freedoms upon us so that the regulators can equally demonstrate, as we're trying to, a determination to create headroom to make sure that this programme can be pushed forward. So from today, and this is the other thing I want to see, is this significant engagement programme involving clinicians and the public. So just a few concluding remarks before I move on to our next speaker. This is tough. This is tough. It's very challenging, but it's absolutely doable. It's absolutely doable. But there are some preconditions that we're going to have to be able to think about. We have to be prepared to be ambitious. We have to be prepared to be radical. I urge you all to be open-minded about the solutions. It doesn't help, although I understand why there might be preconceived views about that which is best. We just have to have open minds and to have debates about this. I'd like you all to be prepared to consider tough decisions. Because whatever happens, whatever emerges, I can guarantee it's not going to be 100% palatable for everybody. And we also need to be certain that there is mutual respect between us as individuals and between the organisations represented in this room. So I'm appealing to you all, really, this is my cri de coeur, I suppose, to organisations, to staff, to trade unions, the public, pressure groups, and the politicians to embrace this programme and to contribute constructively to helping us all find the solutions that the people of North Cumbria deserve. And I guarantee, I'll make absolutely sure that your voices are heard in this debate. So I'm going to stop there. There'll be an opportunity for questions and so forth towards the end of the programme. So I'd be grateful if you could hang on to any thoughts that you've got just for now, because I want to quickly move through the rest of the programme. I think you've probably got the programme, have you? Or you might have seen it. Have you not seen it? Oh, well, I'm sorry. In that case, I would have gone through it first of all. I've done what's down here about the opening address. You might have gathered that. We're next going to have a presentation from Sue Stevenson of Health Watch Cumbria about engaging with local people and the role of Health Watch. And then we're going to have a discussion or presentation led by David Rogers. David, you're the medical director of the CCG, is that correct? Yeah. David's going to talk to us about involving clinicians and staff in this exciting work. Then Sally Burton from the County Council is going to talk to us about working in partnership and the relationship between health and social care. And then Lynn Simpson, who's the Regional Director for the Trust Development Authority, therefore one of our regulators, is going to talk to us about expectations, national objectives of this programme from her perspective. And then we'll have 20 minutes, half an hour, or even longer if you want to, questions and answers in the debate about the things that you've heard. I apologise, I thought you'd seen this before. I should have said this, read this out to you earlier. I hope that sounds okay.